Assalamualaikum and good morning to one and all. Today we'll study about part 3 of antidepressant drug. So before going ahead, let's see what we have studied in part 2 of this chapter. So in part 2 of this chapter, we have studied about the classification of antidepressant drug, and we have studied two important drug or the category of the drug which are used in the treatment of the depression. Those are tricyclic antidepressant drug and selective serotonin reuptake inhibitor. I am Professor Sheikh Abu Sufyan. Welcome you to AS Academy Learning Forever. At the end of this e-learning session, you are able to explain pharmacology of monoamine oxidase inhibitor. They are also called as MAO-I. Discuss antidepressant food drug interaction and explain pharmacology of lithium bicarbonate. So let's see about first drug, that is monoamine oxidase inhibitor. So remember that although in last lecture we have studied two categories of the drug, that is SSRI and tricyclic antidepressant drug, but the first drug which is introduced as an antidepressant are monoamine oxidase inhibitor. For example, the phenelazine, tranylcypromide and iproniazide. So these are first drug for the treatment of antidepressant. But after invention of the tricyclic antidepressant drug, monoamine oxidase inhibitor, they are largely superseded by tricyclic antidepressant drug. Why? Because TCA, they having better clinical effectiveness as compared to monoamine oxidase inhibitor. So MOI, that is monoamine oxidase inhibitor, although they are first drug, and when we study their mechanism of action and the pharmacology, you feel that no drug it is better than MAO-I, right? That is monoamine oxidase inhibitor. But since it having many side effects, having good amount of drug-drug interaction and drug-food interaction, it reduces the clinical effectiveness for the treatment of the depression. Since it having many side effects and drug-drug interaction and drug-food interaction, these drugs are largely superseded by TCA, that is tricyclic antidepressant drug. But although these drugs are superseded, but pharmacologically, as a pharmacy student, you must know what is mechanism of action and pharmacology of this drug. Because there are some patients where you need to give this category of the drug for the treatment of the depression. Now let's see about this drug. So as far as its mechanism of action is concerned, what it does, it produces irreversible inhibition of monoamine oxidase enzyme. And we know that the monoamine oxidase, it is the enzyme which produces the metabolism of the monoamine like 5-hydroxytryptamine and noradrenaline. Okay, and we have seen their level it is deficient in case of the depression, and their level it is increased in case of mania. So these drugs are given in case of the depression because you want to increase the level of 5-HT and noradrenaline by inhibiting their metabolism, right? Because since this drug, they produces irreversible inhibition of monoamine oxidase, there is no metabolism of 5-HT and noradrenaline. As a result of that, their level in the brain it is increased. Okay, so this increase in level of 5-HT and noradrenaline, it may reverse the depression in case of the patient. Okay, so let's see about further detail of this enzyme. So as far as monoamine oxidase enzyme is concerned, monoamine oxidase, it is of two types. So one, it is the monoamine oxidase A enzyme, and second one, it is monoamine oxidase B enzyme. Let's see what monoamine oxidase A does and what is done by the monoamine oxidase B enzyme. So first, it is monoamine oxidase A enzyme. So monoamine oxidase A, it is the enzyme for which substrate preference it is 5-hydroxytryptamine. What do you mean by substrate preference? It means the 5-HT it acts as a substrate, and this enzyme, that is monoamine oxidase A, it converts 5-hydroxytryptamine into its metabolite. Okay, so it is converting 5-HT into its metabolite. So it produces the metabolism of the 5-hydroxytryptamine. Okay, so it produces their metabolism. Since your drug, that is monoamine oxidase enzyme inhibitor, if you have given the specific drug which can only inhibit the monoamine oxidase A enzyme, right? So those drugs are selective in nature. So these kind of drugs which are selective in nature, what they does, they increases the level of 5-hydroxytryptamine. And we have seen in case of depression, the key mediator it is 5-hydroxytryptamine. So deficiency of 5-hydroxytryptamine, it is mainly responsible for the depression. So if you want to have the selective action, you don't want to have the metabolism of the noradrenaline. You just want to inhibit the metabolism of 5-hydroxytryptamine. Then in such case, you can give monoamine oxidase A inhibitor, right? Why? Because they preferentially produces the metabolism of 5-hydroxytryptamine. Likewise, monoamine oxidase B, it having the substrate preference for phenylethylamine. So phenylethylamine does not have much relation with the depression. So monoamine oxidase B does not play much role for the treatment of the depression. So if you are giving the drug which is non-selective in nature, suppose it produces the inhibition of both enzymes, that is monoamine oxidase A as well as monoamine oxidase B, then inhibition of the monoamine oxidase B, since it is not desirable, it may be responsible for the side effect, okay, because you want inhibition of only monoamine oxidase A. So although this is selective action of monoamine oxidase A inhibitor, but in some cases you can also use monoamine oxidase inhibitor which are non-selective in nature, right? Let's see about the pharmacology of this category of the drug. So remember that this drug, what they does, they causes rapid and sustained increase in level of monoamine, that is 5-hydroxytryptamine, noradrenaline as well as dopamine. So their level it is increased. And what you want to increase in case of depression, you want the key mediator, it is the 5-HT, and in some cases noradrenaline it is also affected. So you don't want action on the dopamine. So action on the dopamine may be responsible for their side effect. Let's see what happens when these drugs are given to the normal human subject. So if the person, if he is not suffering from the depression, and if such person it is given with this drug, what happened to such person, right? So monoamine oxidase inhibitor, when it is given to normal human subject, it produces immediate increase in motor activity. And we know that the motor activity it is increased because of the important neurotransmitter, that is dopamine, okay? So the motor activity is increased due to increasing level of the dopamine. So what it does, so this drug it produces a very rapid and sustained increase in level of the dopamine. So in normal patient there is nothing is there, or there is no deficiency of dopamine it is seen, okay? So in such case dopamine level it is already normal. When these drugs are given, what it does, they further increase the level of dopamine. As a result of that, there is immediate increase in motor activity, because dopamine it produces activation of your motor neuron, and due to activation of motor neuron, the person motor activity will be increased. So that person will not sit at one place. That person will start moving from one place to another place. Just a minute, huh? Hello. सर लेक्चर में हूँ मैं, थोड़ी देर कॉल करो. हाँ, ओके. Okay, sorry. So this person will not sit at one place. He will move from one place to another place. Why? Because there is increase in their motor activity. So this is one of the problem when these drugs are given to the normal human subject. So this could be also possible in case of depression. Like in case of depression, you are given the monoamine oxidase inhibitor, right? It will slowly increase the level of 5-HT as well as noradrenaline. But you don't want to increase the level of dopamine, because dopamine deficiency it is not seen in case of depression. There is deficiency of only 5-HT and noradrenaline. So increase in motor activity will be the side effect of monoamine oxidase inhibitor. Second one it produces a euphoria. So euphoria it is basically due to increase in level of noradrenaline, because noradrenaline it is the pleasurable hormone. It increases the pleasure. Likewise, dopamine also produces some extent of the euphoria. So noradrenaline and dopamine both contribute to feeling of great happiness, that is the euphoria. So this is the second pharmacological action of the monoamine oxidase inhibitor. Third one, it produces the excitement of the CNS. So there is the CNS excitement. So these three pharmacological symptoms are seen when the drug it is given to the normal human subject. So there is increase in motor activity, euphoria and excitement. So what happened? Now we'll see what it does with amine metabolism. So how quick the amine metabolism is, and up to what extent the amine metabolism it is affected by monoamine oxidase inhibitor. Okay. So remember that it affects amine metabolism. So its effect on amine metabolism it is very fast, and it is also last for several days. What it means, once you give monoamine oxidase inhibitor, what they does immediately they produces their inhibition of the metabolism. So there is instant increase in level of the 5-HT, noradrenaline as well as the dopamine, and this remain for more time, for more days. Maybe you have given the treatment for a week, but this increase in level of dopamine and noradrenaline 5-HT it remains for longer period of time, because it produces, we have seen in mechanism what it does, it produces irreversible inhibition of monoamine oxidase enzyme, right? So whatever enzyme which is present in your brain, it will be completely inhibited unless and until the new monoamine oxidase it is synthesized by the body. Their metabolism of noradrenaline 5-HT as well dopamine it will be inhibited by this drug. So what is the result of this? It is the result of this is there is sustained and there is fast and the long-lasting increase in level of 5-hydroxytryptamine, noradrenaline, and dopamine. It is seen when you give monoamine oxidase inhibitors. Okay, so this is about important pharmacological action of the monoamine oxidase inhibitor. Another important thing, it causes delayed in down regulation of beta adrenergic receptor and 5-hydroxy 5-HT2 receptor. So why they produces delay in down regulation of these receptors? So this is another pharmacological action. So we have seen what they does. They increases the level of two important neurotransmitter, noradrenaline, and second one it is 5-hydroxytryptamine. So what this drug, this neurotransmitter will do? Noradrenaline will go and activate beta adrenergic receptor, whereas 5-HT will activate 5-HT2 receptor, right? Since it having very long action, just now we have seen it produces long lasting action. Since it having long lasting action, the down regulation of this receptor, down regulation means decrease in expression. Okay, so decrease in expression it is also very important in order to control the action of any receptor, because you don't want the continuous activation of the receptor or continuous expression of the receptor. You want sometime activation of the receptor and sometime you want deactivation of the receptor. It should be properly controlled. But since it increases the level of noradrenaline and 5-HT, what it does, it produces delayed in down regulation of this beta adrenergic receptor and 5-hydroxytryptamine receptor. So there is no down regulation of this receptor, or there is very delay in down regulation of this receptor. So this is happen at theoretical level. So this is the as per theoretical knowledge, that is noradrenaline produces the activation of adrenergic receptor, and your 5-HT produces the activation of 5-HT2 receptor. Due to constant or consistent activation of this receptor, it delay down regulation of this receptor, right? But there are no evidences which support this what we will say the theoretical evidences. So since there is no exact evidences are available, so actual mechanism why they produces a delayed down regulation of beta adrenergic receptor and 5-HT2 receptor, it is not well understood. Why it is not understood? Because there are no good number of evidences are available which can support this our theoretical concept of activation of the noradrenergic receptor by noradrenaline and activation of 5-HT2 receptor by the 5-hydroxytryptamine, right? So this is another important pharmacological action of monoamine oxidase inhibitor. Let's see about side effect of monoamine oxidase inhibitor. So we have seen that the monoamine oxidase inhibitor, they are superseded by tricyclic antidepressant drugs. Although theoretically the mechanism of action looks very fancy. So there is increase in level of good amount of increase in level of noradrenaline 5-HT, and the effect it is also very fast, right? So although it quickly increases the level of 5-HT and noradrenaline, but as far as its clinical efficacy is concerned, it is not as good as tricyclic antidepressant. Why? Because of its many side effects, right? So the side effects are almost same as tricyclic antidepressant, but the intensity of the side effect as compared to tricyclic antidepressant, it is more in case of monoamine oxidase inhibitor. So this is the reason why monoamine oxidase inhibitor are superseded by the TCA or the tricyclic antidepressant drug. So we'll see the list of the side effect. So first side effect, or it is rather the food and monoamine oxidase inhibitor interaction. So this we will see in detail in next slide. So just you remember it produces wine cheese reaction. So we'll see this in a detail. Okay. Other side effect, now onward, all the side effects are highlighted in the red color. I have intentionally highlighted in the red color because all these side effects are also seen in case of the tricyclic antidepressant. We have seen in case of our last lecture, tricyclic antidepressant, they also produces the sedation, they produces the irritability, and as a result of that the patient find difficult to sleep. So there is difficulty in the sleep, so it produces the insomnia, there is the weight gain, right? There is the problem of the sexual function, so anorgasmia it is seen in case of the female, and impotence it is seen in case of the male. Likewise, it produces the postural hypotension. So all these side effects were also seen in case of the TCA. So the same side effects are seen in case of the monoamine oxidase inhibitor. But point to be remembered here is their intensity and the severity, it is more. Why? Because they produces consistent increase in the level of noradrenaline, 5-HT and the dopamine. As a result of that, their intensity of the side effect it is more as compared to tricyclic antidepressant drug. So these are the side effects are produced by monoamine oxidase inhibitor. So as we have seen the first problem with monoamine oxidase inhibitor, it is the wine cheese reaction. Now let's see what is that wine cheese reaction, and this is very favorite question of the examiner. So as a pharmacist, you must know what is wine cheese reaction for two purposes, obviously for your exam purpose, and second thing is that as a pharmacist, when patient is coming to you and to whom monoamine oxidase inhibitor are prescribed, then you must counsel that patient to avoid certain kind of food. So let's see which food it is to be avoided and what is the reason behind this. So the interaction which is caused by monoamine oxidase inhibitor along with the food, it is called as wine cheese effect, or it is called as wine cheese reaction. Okay. So let's see what it does and why it is called as wine cheese reaction. Okay. So monoamine oxidase inhibitor, what they does, they enhance indirectly acting sympathomimetic drug. So what they are doing, they indirectly producing the stimulation of the sympathetic receptor, that is adrenergic receptor. Obviously, their direct action it is on the increasing level of noradrenaline. So noradrenaline is going to act on sympathetic receptor, that is adrenergic receptor, and it mimics these receptors. So mimicking means what? It produces the activation. So it produces the activation of the sympathetic receptor. But what is happening here? So this is in case of the normal patient who is not taking the food which contain or which produces this type of reaction. So normal patient also it produces activation. But it is in case of wine cheese effect, what is happening? This effect it is further enhanced, right? So further there is enhancements of this sympathomimetic action which produces the complication or toxic effect. Now let's see how it produces and what is responsible for this. So remember that the main culprit behind wine cheese reaction, it is the tyramine. So all those food which contain the tyramine, for example, it is present in a certain case of the wine, it is present in case of the cheese, it is also present in case of the liver. So liver of the goat or liver of the chicken, it also contains good amount of the tyramine. So what happens when these foods are taken along with monoamine oxidase inhibitor? So that is what we need to study today. So the tyramine in certain food is not metabolized in presence of monoamine oxidase inhibitor, right? So what these drugs are doing? So these drugs basically they produces the inhibition of monoamine oxidase enzyme. So they produces the inhibition of monoamine oxidase enzyme, and also they produces the inhibition of the tyramine, right? So now what tyramine will do? Okay, so there will be increase due to inhibition of the monoamine. There will be increase in level of noradrenaline. There is increase in level of 5-HT. So these are called as the catecholamine, or these are also called as the monoamine, right? Whereas the tyramine, what it does, it also potentiate catecholamine release. So already due to inhibition of metabolism of the noradrenaline 5-HT due to inhibition of monoamine oxidase enzyme, there is increase in level of noradrenaline as well as 5-HT. In addition to that, tyramine, it also produces the release of these catecholamines. So tyramine, it is potent having the potent action on the tyramine release. So it potentiates the catecholamine release, right? So since there is increasing level of tyramine, it will potentiate catecholamine release. So catecholamine means it also produces the release of both noradrenaline and 5-hydroxytryptamine, right? So what is happening here? So the noradrenaline 5-HT level it become double. Why? Because it is increased due to inhibition of the metabolism, as well as it is increased due to release of the tyramine, because tyramine in the food, it will also potentiate the catecholamine release. So there will the level of noradrenaline 5-HT in the blood circulation become a double, and as a result of that, it produces very severe acute hypertension. So there is sudden increase in the blood pressure. It is seen when you are taking the food like the cheese, wine, or the liver, which contain the tyramine, and when it is taken along with monoamine oxidase inhibitor, the patient will suffer from acute hypertension. So suddenly there is increase in the blood pressure to the extent where patients suffering from severe throbbing headache. So throbbing headache, you might have experienced that it is very severe kind of headache where you feel that there is someone is hammering in your brain, isn't it? So this is very severe kind of thrombic headache, and in severe case, if you are not controlled at this level, or if you have not treated this hypertension, then it increases the risk of intracranial hemorrhage, because due to increase in the blood pressure, that is acute hypertension, what it will do, it will produces the rupture of the blood vessels. Okay, so there will be the rupture of the blood vessel which are present in your skull, right? And as a result of there will be intracranial hemorrhage. So intracranial hemorrhage, it is not something which is the normal condition, but it is the life threatening, because it may produces the brain clot, it produces the blood, it produces the clotting of the blood in your brain. So it is called as the blood clot. So blood clot, it is produced in your brain, so that is very dangerous. It may lead to the paralysis, and sometimes it may lead to the death of the patient, isn't it? So it's look like very simple, like eating cheese, wine, or the tyramine containing food. It may also happen accidentally. Maybe sometime you are not remember, you are already suffering from the depression, so your memory it is not that is good, right? So you doesn't remember that you are not to take these medicines. Suppose accidentally you have taken this medicine, then you are at the risk, because it produces very severe acute hypertension, severe throbbing headache, and there is increase in the risk of intracranial hemorrhage. So these reactions, so these symptom, or this reaction of monoamine oxidase inhibitor, which is seen when tyramine containing food are consumed by the patient, it is called as wine cheese reaction. Okay, so it is called as wine cheese effect. So it is well known drug food interaction which is related to monoamine oxidase inhibitor, right? So we have seen the drug food interaction. Let's see about interaction of monoamine oxidase inhibitor with the drug. So earlier was the food interaction. Now we'll see which drug are interact with the monoamine oxidase inhibitor, so that you should avoid co-administration of those medicine. So there are two categories of the drugs which produces the severe interaction with the monoamine oxidase inhibitor. So first drug, it is sympathomimetic amine. What sympathomimetic amine will do, like ephedrine, amphetamine, these are widely used drugs, right? So ephedrine, it is widely used. Like amphetamine, it is seen as stimulant. It is a good number of time you are using the amphetamine. So now when ephedrine and amphetamine are given along with monoamine oxidase inhibitor, what it will do, it will produce the same action as the tyramine containing food, because tyramine also produces sympathomimetic action. So ephedrine produces sympathomimetic action. In addition, monoamine oxidase inhibitor, they also having sympathomimetic action. So both the action together, it produces the synergism, right? And the result is very severe acute increase in the blood pressure. So there is the severe increase in the blood pressure, and sometimes it is called as hypertensive crisis, because blood pressure, it is to the extent it may produces some complication in the patient, right? So it is called as, it produces severe hypertension. Another category of drug, they produces or interaction with the monoamine oxidase inhibitor, it is the TCA. So the TCA, when it is given along with the monoamine oxidase inhibitor, what TCA does? TCA also increases the level of noradrenaline. Okay, monoamine oxidase inhibitor will also increase the level of noradrenaline. So now the level of noradrenaline, it becomes very high, right? Again, same effect. Increase in level of noradrenaline produces increase in the heart rate, force of contraction, and increase in the blood pressure, which contribute to the hypertensive episode. So there is again the problem of severe hypertension. So to conclude, all drug-drug interaction or drug-food interaction which is related to monoamine oxidase inhibitor, they produces hypertensive crisis. They produces very severe increase in the blood pressure. It may lead to the some severe complication in those patients. That is the reason why you should take special precaution when patient is on treatment with monoamine oxidase inhibitor. So they should not be given with the food which contain tyramine like the cheese, wine or the liver. Likewise, they should not be co-administered with the drug like ephedrine and amphetamine. They should not be given with the TCA. So we have seen the pharmacotherapy of antidepressant drug. We have seen that TCA, and there is drug-drug interaction between TCA and SSRI. It produces very severe kind of syndrome that is called as serotonin syndrome, right? Likewise, there is drug interaction between TCA and monoamine oxidase inhibitor. So this is the reason why antidepressant drugs are not given in combination. We have seen in case of anti-Parkinson drug are used in combination, sometimes antipsychotic drug are used in combination. But remember that two category of antidepressant drug are generally not given in a combination because they having drug-drug interaction. This is very important point that you must remember. So we have done with the monoamine oxidase inhibitor. Now let's start with pharmacotherapy of the bipolar affective disorder. So till now what we have studied was the pharmacotherapy of the depression. So we have seen three categories of the drug. One, it is tricyclic antidepressant. Second category we have studied was selective serotonin reuptake inhibitor, and third category was monoamine oxidase inhibitor. So these three categories of the drug are used in the treatment of the depression. Now, but we have seen that in case of certain cases, the patient mood is not stable. He is not only suffering from the depression, but his mood it is swing from mania to depression, and sometimes from depression to the mania. So there is mood swing is occur. What it means, their mood is not stable, isn't it? So in such patient, like sometimes he may be quiet and isolated, that is the symptom of the depression, and sometimes he become very aggressive, start shouting, become over enthusiastic, so that is the symptom of the mania. So this alternate, so patient mood it is alternate between the mania and the depression. So in such cases, you want a drug which can stabilize the mood. So the category of the drug which is used for the treatment of bipolar affective disorder, they are called as mood stabilizing drug. So we are using mood stabilizing drug for this treatment. So first mood stabilizing drug that we will study today, it is the lithium. So it is the most commonly used. In addition to lithium, we can also use anti-epileptic drug. So you have studied the anti-epileptic chapter, so in which we have studied the carbamazepine in detail. We also studied the valproate and the gabapentin. So I am not repeating the pharmacology of this drug in detail because this drug we have already studied in case of anti-epileptic chapter. Okay, but you remember that carbamazepine, valproate, and gabapentin, although these are anti-epileptic drugs, but the observation or the study it observed that it having the less side effects. And it also proved efficacious for the treatment of bipolar affective disorder, right? So although it is anticonvulsant, but it also having mood stabilizing action, and since it having less side effect, these drugs can be are widely used drug for the treatment of the mania. Okay, so I am not going to teach today the pharmacology of this drug because we have already studied this drug. So let's see pharmacology of the lithium. So we'll study today about the lithium. So do remember that the lithium, it is monovalent cation. What do you mean by monovalent cation? Like sodium, right? Sodium, what charge is present? Positive charge is present. How many positive charge are present? Only single positive charge, right? So the lithium, it also contains the single positive charge. So it is called as monovalent cation. So it is, since it is monovalent cation, what it does, it mimic the role of sodium, because sodium also having single charge, lithium also having single charge. So what it does actually, mimic means what? It act like sodium, right? So it mimic the role of sodium, and what sodium does? Sodium, it is responsible for action potential. So it is responsible for generation of action potential, and that is also called as a depolarization. When sodium entry is happening in the membrane, it produces decrease in negativity. Earlier in the membrane, it is present in negative charge, so that is called hyperpolarization. So it converts membrane from hyperpolarized state into depolarized state, right? So the same thing, when lithium goes into the membrane, it acts as the sodium, right? But problem with the lithium is that, now very important point it is there, that while lithium, it acts as a mood stabilizing agent, right? So what happens when there is sodium entry inside the membrane? So suppose this is the membrane, right? So inside is negative charge and outside always positive charge is present, right? So when there is sodium entry is there, it produces the depolarization. So this is what we have studied. So now, once the job of sodium is over, depolarization is over, again there must be the repolarization. Do you agree? These are the different phase of the generation of the action potential, then different phase of the conduction cycle, isn't it? So once sodium it is entered, their job is done, depolarization is over. Next phase, it is the repolarization, where the sodium must go out and it should be exchanged with the potassium, right? And this process, it happens with the help of the energy in the form of the ATP. So in all this process, the sodium which is taken out of the membrane by using sodium potassium ATPase pump. So the special pump is required, or it is there already in the membrane. It is called a sodium potassium ATPase pump. What it does, it takes out sodium from inside to outside the membrane, right? So what happens? So this sodium potassium ATPase pump will take out the sodium. So it will take out the sodium from this membrane. But remember that you have given lithium also, but it will not take out the lithium, because the lithium, it is not pumped out by the sodium potassium ATPase pump, and as a result of that, that lithium, it remains inside the excitable tissue. So it accumulates inside excitable tissue and keep that tissue depolarizing. So the depolarization, it is continuous, and which help in stabilization of the mood. Now let's see what happened at the molecular level. So this, you understood that the lithium, since having the same charge, it mimics the role of the sodium, go inside the membrane, produces the generation of the action potential. But sodium potassium ATPase pump, it take out the sodium but does not take out the lithium. So lithium remains inside the membrane and keep membrane activating. So there will be continuous depolarization of the membrane, and it helps to maintain the mood of the patient, or to maintain or to stabilize the mood of that particular patient, because lithium, it is stuck inside the membrane. So there is no possibility of change in the mood. So mood, it is remain as such. Okay. Now let's see what happened at the molecular level. So lithium at molecular level, it basically produces reduction of neuronal secondary messenger. And what secondary messenger does? So secondary messenger, they are responsible for amplification. Okay, so they are responsible for amplification of the response, right? So if the lithium, it produces the depolarization, then the secondary messenger, right, they produces more and more depolarization. Likewise, since it produces the reduction of the neuronal secondary messenger, this amplification of the message, it is reduced. Okay, as a result of that, since amplification, it is reduced, what it does, it results in reducing response of neuron to acetylcholine and noradrenaline. So response of neuron to acetylcholine and noradrenaline, it is reduced. So in case of mania, major neurotransmitter affected, it is the noradrenaline. It is due to the functional excess of the noradrenaline, right? So what it does, it reduces the response of neuron to acetylcholine and noradrenaline. So although these neurons are there, noradrenaline is present, but that noradrenaline, it will not able to activate adrenergic receptor, right? So there will be no further activation of this sympathetic receptor, right, which is responsible for the mania. So this is how it produces sympatholytic action, or they reduce the response of the neuron to acetylcholine and the noradrenaline and reduces the symptom of the mania. However, in case of the 5-hydroxytryptamine, what it does, it increases the level of the 5-HT. So 5-HT is a key mediator in case of depression, right? So what they are doing, since there is increase in level of the 5-HT, there will be inhibition of the depression. So depression, it is due to deficiency of 5-HT. So what they does, they enhance the level of 5-HT. So this drug can inhibit your depression. So depression, it is inhibited. Okay. So depression, it is inhibited. While since this drug, they increases the level, they reduce the response of the noradrenaline. So as a result of that, they can also control the mania. So mania, it is control. So both mania as well as depression, it is controlled by this drug. Okay. So I hope it is understood to you. So mania and depression is controlled due to reducing the response of the noradrenaline and due to increase in the level of the 5-hydroxytryptamine. So same drug, it is producing the desired effect. So it is inhibiting depression and it is also inhibiting the mania due to the stabilization of the mood. So this is how the lithium it's work. Now let's see about the clinical pharmacology of the lithium. When you are giving lithium, what parameter you must consider? Let's see that. So you remember that it is the primary therapy for the mania. So first choice drug for the mania, it is a lithium. But in case of lithium, it having narrow therapeutic index. So therapeutic index is very narrow, between 0.8 to 1.2 milli equivalent per liter. It means just 0.4, difference of 0.4 milli equivalent is there. Okay. So what it indicates, therapeutic range. If there is concentration below 0.8, the lithium does not produces the mood stabilizing action. If concentration go above 1.2, the lithium, it produces the toxicity, isn't it? So here you may see the lithium toxicity. As a result of that, the maintenance of lithium concentration between 0.8 and 1.2 is very challenging, and to ensure that, you need to monitor the serum level of the lithium. So serum concentration of lithium, it is to be monitored. It should come between 0.8 to 1.2. So if it is going beyond this, it produces a toxicity. So you can reduce the dose of lithium. If it is coming below this, it won't produce the mood stabilizing action. So accordingly, you can increase the dose of the lithium. So on trial and error basis, you can try to stabilize the mood of the patient by monitoring the serum level of the lithium. So it is very challenging. So this is only possible when patient it is hospitalized. If it is not hospitalized, it is very difficult to take the blood sample and to check the concentration of the lithium. Okay. Second thing is that the lithium, it is solely eliminated by the kidney. Means it is only eliminated through the urine. It is eliminated through the kidney. Now imagine if the patient is suffering from the kidney impairment. So in such patient, there is no excretion of the lithium. So suppose if there is 30% impairment of kidney function. So now 30% of this lithium, it is not excreted for that day. Likewise, next day further 30% it is accumulated. Likewise, there will be accumulation of the lithium, and this range will go beyond toxic limit, right? And it may produce the toxicity. So what you can do before treatment with the lithium, you need to assess kidney function. So patient kidney function need to be assessed. So it is assessed by measuring the GFR, that is glomerular filtration rate. So if it is below and you see that there is the reduction in the GFR, then accordingly you must reduce the dose of the lithium. Otherwise their concentration will go beyond toxic range or beyond normal range, and it produces the toxicity. So these are very important points. Let's see what are the adverse effects. So adverse effect of the lithium, it including the tremor, it produces the tremor. That is the tremor, it is means that is involuntary movements of your legs or your hand or the organ, that's called a tremor. There is decrease in thyroid function, so it increases the risk of hypothyroidism. There is polydipsia. Polydipsia means increase in a thirst. Okay. So why there is increase in a thirst? Because of it also produces polyuria. It produces increase in urinary output. So if there is more urinary output, more will be the water loss. Patient will having more thirst. Right. Likewise, it produces the edema, which is very severe. It produces ECG change. So it produces depression of the T wave of the ECG. And lastly, it is excreted in the breast milk. So what precaution you must take? So if lithium it is given to the breastfeeding mother, that mother should not feed milk to their child, right? So in case of infant, the mother should not give the milk. Otherwise, that lithium will go into the child and it will produces the toxic effect in case of the child, right? So these are all problems are there with the lithium. So you should give lithium with precaution and the monitoring. Like you need to monitor the ECG, you need to monitor the level of the thyroid, right? You need to monitor the level of the lithium in case of the blood, and accordingly you can decide what dose to be given. You need to monitor the patient kidney function, right? Otherwise it may produces the very severe side effect in case of the lithium. So this is all about lithium bicarbonate. Let's see what are the other medication. So other medication used for the mood stabilization, including anticonvulsant drug that we already seen, like carbamazepine, valproic acid for the rapid cyclers. Rapid cyclers means those in the patient who are quickly going, their mood it is quickly changing from depression to the mania. It is not something like for 1 week they are in a depression and next week they are suffering from the mania. But this mood swing is occur quickly. Like morning they are in a depression and suddenly within maybe half an hour they are suffering from the mania, right? So if this type of patient are there, they are called as the rapid cyclers. So in case of rapid cycler, you can use the carbamazepine and valproic acid. You can also use olanzapine. It is also approved for the treatment of the mania. Okay, so this is all about antidepressant drug. So I have referred these two books for to gathering the information from this chapter, KD Tripathi and HP Rangantel. So I wish you go through this chapter through this textbook that I already uploaded on the Google Classroom. So let's revise this session through Q&A. My first question is the name monoamine oxidase enzyme that produces 5-HT metabolism. Yes. So I am monitoring your answers. So my first question is name monoamine oxidase enzyme which produces metabolism of 5-hydroxytryptamine. Yes. I am waiting for your answer. So Shahnawaz given the answer, Tuba Karbari given the answer, right? Nurun Nisa, Nida, right answer it is monoamine oxidase A, because monoamine oxidase A, the substrate preference it is 5-hydroxytryptamine. So their level it is increase if you give monoamine oxidase A inhibitor, or monoamine oxidase A it produces the metabolism of the 5-HT, right answer. My next question is which category of drug it produces wine cheese reaction? So we have seen one category of the drug which produces wine cheese reaction. We had good amount of discussion on this reaction. So what is that category of the drug? The drug which produces wine cheese reaction. So right answer, Nurun Nisa say monoamine oxidase inhibitor. Saqib has given right answer. Uzma Qureshi, Arjuman Lugde. Right, it is monoamine oxidase inhibitor. So monoamine oxidase inhibitor along with the tyramine containing food like the cheese, wine, the liver, it produces very severe hypertensive crisis, hypertension, throbbing headache, and it may produces the cranial hemorrhage, and that is the reason we are not giving monoamine oxidase inhibitor along with all those food which contain tyramine, right? My third question is give few example of the drug which produces hypertension with monoamine oxidase inhibitor. The drug which produces hypertension with monoamine oxidase inhibitor. Yes. So we have seen the three example of this drug. So right answer, it is ephedrine and amphetamine. So ephedrine and amphetamine, it produces hypertension. Good. Zareen has also given the answer, right? It's correct. It is ephedrine, amphetamine. They are having sympathomimetic action. Also TCA, right? Tricyclic antidepressant drug. They also produces hypertension because both TCA, ephedrine and monoamine oxidase inhibitor, they produces sympathomimetic action. So this action, it is too high and it produces increase in the blood pressure. Very right. My next question is, recommend two drug for treatment of bipolar affective disorder. Recommend any two drug for treatment of bipolar affective disorder. Yes, which two drug we are using for treatment of bipolar affective disorder? In case of mood swing, right answer Nurun Nisa. So lithium and carbamazepine. What about others? I want everyone to give the answer quickly. Very good. Shaista, Tuba, Aksa. Yes, it is the lithium, carbamazepine. So some of the anticonvulsant drug, gabapentin is also there. Valproate, very good. Yes. So we are seeing first drug, it is the lithium, and many anticonvulsant drug like olanzapine, carbamazepine, valproate, they are also having mood stabilizing action. My last question is, which organ function assessment is needed before the treatment with lithium? Which organ function assessment or which organ function you test before you are giving treatment with the lithium? Yes. Very good. It is the kidney function. Nice. So it is a kidney function assessment. It is to be done whenever we are giving treatment with the lithium, because lithium, it is solely excreted by the kidney. So since it is solely excreted by the kidney, you must check their function. Otherwise, what will happen? There will be accumulation of this drug which may lead to toxic effect. Okay. So I have done with my session. So thanks for watching my session. If you like my session, then do remember to give me a thumbs up. So thank you. I am releasing attendance in a chat box. Give attendance and say done, and then you can leave.